okay today. I'm not gonna lie, I am still pretty sore from doing my hair yesterday, but it was worth it. I'm able to feel like I look nice today and feel good about myself, so it's a good day. And if you can, of course, do me a favor, hit that like, share, subscribe button. I would greatly appreciate it. So today I just wanted to give a little rundown about what RA is and how it affects our bodies. So, what is rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disease where your immune system basically attacks itself, and your immune system is in overdrive to where it starts attacking joints and ligaments and sometimes organs. In my case, it has attacked my bones and caused bone erosion from having so much inflammation and not being able to get rid of that inflammation in the beginning. It does require a diagnosis from a medical professional, and there is no cure, but there are treatments to slow down the progression of the rheumatoid arthritis, because it is a long-term, lifelong thing. So without any treatment, it could cause way more problems to more than just your bones or joints, like your organs. It can completely shut your immune system down and attack your organs. Symptoms include swelling, inflammation, depression is one thing that a lot of people kind of, don't think about when it comes to rheumatoid arthritis. But not only due to the chronic pain that is also a symptom, I believe that is a key factor that causes depression and anxiety. Some days, which I have a lot of those days where I don't want to, or I feel like I'm not able to get up and just enjoy a regular day, either because I'm waking up in excruciating pain or I didn't get enough sleep the night before from being in so much pain, and just trying to cope with all the responsibilities of a normal everyday today life. And being able to get up, smile, and dress myself is a good day. The days I wake up in pain and I'm not able to dress myself, or I just feel extremely so low and not sure of the reason why and just can't shake it. Yeah. Those are the things that you really don't think about when it comes to rheumatoid arthritis, but that plays a really big part on a lot of days. Just having those days like, what the heck? How am I even going to get through today? But although there is not a cure yet, there are several medications that the doctors can prescribe to control the rheumatoid arthritis. And one thing that I had to learn, it took me quite a long time to learn and realize that there is not a set of medications that the doctor knows for certain that it's going to work for you. Every medication is different for everyone's body, because the RA can affect this part of the body in one person, this part of the body in another person, and so on. So each medication doesn't just work for everyone. You have to find trial and error of what works best for you. And sometimes there's a combination of these medications and drugs that will get that job done for you. The first medications that the doctors and emergency rooms ever first started me on are non-steroid medications. Things like naproxen, ketoprofen, aspirin, and things like that, to try to control the inflammation and a little bit of the pain that's associated with the inflammation. as well as steroids, ibuprofen, 800s. Those are supposed to help with inflammation and pain. But let me tell you, for me, I took ibuprofen 800s like they were Skittles. I'm surprised I still have kidneys now, and they did absolutely nothing for inflammation or pain. For me, anyway. Now, when it comes to getting medication for pain, that's kind of like non-existent. If you even bring that up in the doctor's office, they look at you like you're a drug addict. If you do need pain medication, they suggest you to go to a pain clinic. But I'm 30 years old. Well, 33, whatever, who's counting? But what do I look like taking narcotics for the rest of my life every day? But, sometimes I would love to just have one night a week to just get normal rest, one good night of normal rest. Medication for that, I could understand, and I wish doctors would understand things like that as well. But it's just not an option. Pain medication is not an option. So if you treat the pain, you're not treating the symptoms and the problem. So that's why. Another form of medications that the doctors will try are steroids, either by mouth or injections. I've tried both. The steroid shot in my hand was the most painful shot I have ever had. It hurt when they gave it to me, it hurt after they gave it to me, and it hurt the next day. And it made a huge bubble on my wrist and it changed the color of my skin as well. And guess what? It didn't help at all. I felt normal for like 30 minutes, and then I was right back in pain. So I never did another steroid shot, and I don't think I ever will. They'll have to hold me down to do that. Also, there are the immuno suppressants. Forgive me, I can't say that word. But it suppresses your immune system so that your immune system is not continuously attacking itself. So it's basically like your body recognizes all of your healthy cells as bad cells, and they try to take away all those bad cells, and instead they're depleting the good cells as well as the bad cells. And we need those good cells. So these medications are to kind of slow that process down and cut that off. These medications are like methotrexate, leflunomide, hydroxychloroquine. I've tried methotrexate first, and the symptoms did not sit well with me. I'm now on leflunomide as well as Enbrel. And so far, haven't really noticed any negatives. But I will be sure to let you know. It's only been 2.5 months, and I will definitely keep you posted on that. But also, the next type of medications are biologics. These medications are more aggressive to suppress your immune system and try to reverse the condition. These medications are Enbrel, Humira, and Cutuxin. I haven't had that one, but I am currently taking Enbrel injections once a week, along with the leflunomide. And together, these two medications are supposed to work to alleviate so much inflammation, which it has done. My wrists used to look like I had baseballs in them. They've definitely controlled the inflammation. I really wish that I could get something to control the pain, but that's, like I said, non-existent. So as long as I keep the condition controlled, as much as I can, the pain should be as minimal as it, I guess, has to be. Because there's really no days when there's just no pain at all. Because since there's no movement in my hands, which I'm not sure if it came from wearing the braces for so long, but without the braces, I literally couldn't even raise my hand to ask a question. But now they don't even bend. So I guess that's where the pain is coming from on those days. But overall, that's pretty much what rheumatoid arthritis is. And I'm not even going to get started on the carpal tunnel. But that is pretty much that on that. And I appreciate you watching. I hope you all learned something. That if you know anybody who has rheumatoid arthritis and you think that, oh, you're fine, maybe they're really not. And on their best days, they're really like on the inside and just trying to keep it cool, calm, and collected. So just try to keep that in mind for us and others that deal with things like this, because it's really not easy, even though we make it look easy on our best days. But I'm going to try to show y'all what the worst days look like too, because keep it all the way real with you, okay? But thank you so much for watching. Till next time.